Hello, welcome to Within the Frame, where we delve deeper into the top stories taking place not only in South Korea, but across the globe. I'm Kim Bo-kyoung. Last month, China suddenly dropped its stifling COVID controls after 3 years of self-imposed global isolation. Hopes were high as the world's second-largest economy reopened its doors. However, as the restrictions loosened, COVID-19 cases in China skyrocketed, leading to pessimism over whether China's reopening would give a timely boost to a global economy that is already suffering from inflation and disruptions to global supply chains. Why did China suddenly change its COVID-19 policy? What is the COVID-19 situation like in China? And when will this wave ease? For an in-depth analysis of those issues, we have Ben Cowling, chair professor from the University of Hong Kong, on the line through Skype. Hello, Professor. Welcome to the show.
Hello.
Yes, and we also have Su Chin-do, senior fellow at Pangong Institution, on the line as well. It is a pleasure to have you on the show.
Thank you for having me.
All right, Professor Cowling, first question. China is no longer tallying the total number of infections, and so estimates on the number of COVID-19 cases and deaths are coming out from various sources. What is your estimate?
Well, my colleagues at Hong Kong U have looked at this. There's nothing holding the virus back. There's no immunity from previous waves, and vaccines prevent severe disease, but they don't stop infections. So it's likely that the vast majority of the population across China will be infected this winter. That means more than 1 billion infections with COVID this winter. The number of severe cases is much more difficult to estimate. My colleagues at Hong Kong University said perhaps 1 million deaths, but that number could go higher, could go lower, depends on a lot of different things. But it's certainly that it's a very difficult situation in many hospitals in China right now.
Right, so more than 1 billion for this winter, that is a huge number. Mr. Su, China abruptly dismantled its strict zero-COVID policy at the start of December, which had been in place for almost 3 years. Why the sudden change of policy?
Well, I think people has been looking at the change of the policy. Mostly, I think there's a frustration. Obviously, after nearly 3 years of quarantine, the way of life, people are tired of that, and the local officials, they are tired of this policy. It's quite I would say exhausted. People are exhausted, and then you see at that point, and then there's more and more understanding of the virus. Basically, the consensus is growing at that time that the virus is milder, much milder than say the strain at the beginning, for example, Delta, which is lethal. So I think all those factors led to the decision, always a time to reopen the society, and also economic pressure. I would say there's an economic price China has paid for such a way of life for nearly 3 years, and then all those factors had led to the opening of the society.
Right, so two main reasons. So first, people's exhaustion and the economic pressure. Now, Professor Cowling, how come this exit from the zero-COVID policy has caused such a big tsunami of infections? I mean, what is the main reason behind this? Is it like a low vaccination rate?
Well, the Omicron subvariants now are highly transmissible. The reproductive number, the R number, that's the average number of secondary infections from each person who's infected. Remember, at the beginning of the pandemic, it was maybe 2 or 3. So one infected person maybe infected 2 or 3 more. That led to rapid growth in cases. Now, with the latest Omicron subvariants, the R number is above 10. Some Chinese experts estimated 16. And so one person is infecting a lot of others, and there's no immunity in the population. The vaccine coverage is very high. In China, it's like 90% with at least 2 doses across the population. But vaccines are not stopping infections. They're just reducing the severity of infections. The infections would be much worse if they were occurring in unvaccinated people. So with a high transmissibility, with no immunity against infections, and nothing to slow down the virus, no measures to slow down the virus, spread is extremely rapid.
Right, Professor Cowling, one more question to you. Going straight forward from containment to return to normal, I mean, lots of experts say China was too hasty as it did not implement interim mitigation measures. What kinds of measures should Chinese authorities have made for a soft landing?
Well, I think that's right. And I would go back even before the transition to say, when there's a plan to stop containment, think about what's going to happen next, i.e. a big surge in infections, pressure on hospitals, and make a plan for that. Get hospitals prepared, think about measures to slow that process down. Universal face masks, close schools in January, do some social distancing measures in the community just to slow things down. We're seeing a lot of severe cases appearing at hospitals within the space of maybe 2 or 3 weeks in the major cities. That's already happened in Beijing and Shanghai and elsewhere. If that could be slowed down so that the cases appear not within 2 weeks, but within a month or within 2 months, so you spread them out, that means there's more resources available for each of those severe cases. Even if the total number ultimately isn't changed, the impact will be lessened by flattening the curve. And that's what we've known for 3 years with COVID, but it hasn't happened in China. They've gone straight from containment measures, which were working reasonably well, but struggling at the end, all the way now to living with the virus without having this mitigation phase in the middle that I think most other countries have gone through.
Right. You see, we also should look into how such a surge is affecting Xi Jinping, who recently secured a third term in power. Now, Mr. Su, during his New Year's speech delivered last Saturday, Xi made a rare admission of tough challenges experienced by many due to the pandemic controls. Now, what does he mean by tough challenges, and what does Xi's rare admission and softer tone imply about Xi's thoughts?
Well, I think, for a lot of Chinese, in particular, in 2022, we know this zero COVID policy was working, but at a higher price to be paid by the people. For example, people probably they have to stay indoors or have to be, have to go to the centralized quarantine places, for example, that kind of practice, because it was getting more difficult to stop the transmission of the Omicron virus, which is extremely transmissible, as said by my colleague here. And so it's very different from the past 2 years, the previous 2 years, I would say 2020, 2021, China had done pretty well, and people get along with that kind of policy pretty well. The economy was growing too. So only, I think, in 2022, the country met such a big challenge. So that's why President Xi Jinping was talking about, this extreme challenges, basically, and everyone is not easy over the past year, basically. He admitted, the difficulties the country, the nation, the people have experienced in 2022. And also I think basically he was sending out a message that, you are frustrated and you are tired. And I heard that. I knew what's going on the ground.
Right, Professor Cowling, going back to the situation in China, it is said that the tsunami of COVID-19 infections in China is causing shortages in key drugs, making Chinese people scramble for medicine across Asia. But not only that, crematoriums are reportedly filled with bodies waiting to be cremated. Now, what does this say about China's capability to deal with the virus?
Well, I think the limited capability is the reason why zero COVID was in place for so long. If this had been happening 2 years ago, when vaccine coverage was very low, vaccine was just starting being used, it would have been much, much worse. If this was happening a year ago, when vaccine coverage was 85%, not 90%, but we didn't have antiviral drugs at that point, it would have been worse. And that's why zero COVID was maintained for so long. I think the question many people are asking are, why wasn't there more preparation to say to hospitals, get ready for this kind of surge? Because the U-turn in policy happened almost overnight. There were hints that it might be going to happen for about a month, but it was really a very short notice for hospitals and for the community to get ready. And I would say reopening in the winter is the worst choice of time to reopen, because these viruses spread best in the winter, and there's other things happening in the winter, other viruses circulating, which also put pressure on hospitals. So that's really the surprising thing. But right now, as we saw the pictures, it's really very concerning for many people across China, many hospitals across China.
Right. So policy change that happened overnight is making China suffer, and battle its biggest ever COVID-19 surge. But will this in any way negatively affect Xi Jinping's, political power? Mr. Su.
Well, if you look at the previous 2 years, as I said, people were happy generally with this zero COVID policy. They were living in a virus-free environment, and at the same time, the economy largely was on the positive side. If you compare the Chinese economic expansion, actually at one point it was the quickest among the major economies. But in 2022, I would say with the Omicron variant, it's a different story. So that's a big challenge. And also, I think there's underestimation of how severe the virus is. Despite all the talk of being mild or being milder, it still proves to be very tough for, in particular, for the vulnerable group of people, for those aged 65 and above. And there's also a problem with the Chinese, this senior population. For example, their vaccination with a booster is rather low, 42%, for example. So that also contributed to the problem, I think, when it was opened, when people see the surge of infection, and many, including the Chinese scientists and medical workers, they said that's beyond the expectation of the speed and of the scale. So and at the same time, if you look at the response from the Chinese government, they are readjusting swiftly about their policy. For example, right now, the focus is about the grassroots clinic, obviously empowering. What they are doing is to enable the grassroots clinic, for example, community-based or village-based, to make sure they have the ability to identify and treat the patients. At the same time, the focus is also on a vulnerable group to ensure they have access to the drugs for example, for fever, for cough, and also for anti-terror medicine to save as many lives as possible. So overall, I would say yes. People say they could have done better job. But at the same time, people are looking. In general, people say open the society is the right approach at the end of the day.
Right. Well, we cannot miss, the concerns over variants as well. Now, Professor Cowling, have any new variants been found in China? And if new variants of COVID-19 are found from Chinese travelers going abroad, how should health authorities in other nations, including South Korea, prepare against them?
Well, so no new variants yet. The virus is being detected, the strain is being detected, BA.5.2 and BF7. These are strains which have been detected around the world in the past 3 months. They're not new strains. They're old strains, actually, of the virus. They're spreading in China very rapidly. There doesn't seem to be anything too new at the moment. The one strain that epidemiologists are focusing on now is actually XBB.1.5 being detected in the United States. We know that new subvariants will emerge from time to time. They will spread around the world. PCR testing before departure will not stop that process. It will not even slow it down. So at the moment, I think what we can do is to detect any new strains as early as possible, have a risk assessment, have preparation in place. I don't think it makes any sense to try to stop the spread of new variants. We know that will not work. PCR testing before departure will not slow that process down. It's just annoying and disruptive and costly for travelers. So that's a surprise that so many countries are implementing the PCR testing requirement for travelers from China, not, by the way, from the United States, where XBB.1.5 is being detected in increasing proportions, but from China, where they have variants that are already detected. Anyway, that's the current situation.
All right. Well, Mr. Su, moving on to how other countries, like Ben Cowling said, how reacting to the surge, with many countries imposing travel restrictions, China said such moves are political and that the country would retaliate. What kinds of retaliation could China make, and is it going to really make those kind of retaliations?
We don't know about that yet, but I think for the response to the Chinese reopening is mixed. You do see countries like Thailand and other Southeast Asian countries in particular, they are welcoming the Chinese tourists who are the biggest spenders in the world. So people are looking at the recovery of the tourism industry. They welcome this move from China. Of course, there are countries who impose additional restrictions like a PCR test 48 hours before the border entry. I think right now China has a problem is with the United States. We know what happened at the very beginning of the outbreak, 3 years ago. The Trump administration basically called the virus China virus, politicized this whole outbreak, whole virus issue, and it's very sensitive for China. Now seeing the U.S. imposing restrictions on the Chinese travelers, and even people in the United States, in particular Asian community, they are also concerned about the, let's say, re-emergence of the anti-Asian attacks or discrimination. People, the underlying message is like, oh, it's a China virus, it's from China. So this is not good to the Chinese travelers, and also this is a very concerned with the Asian community inside the U.S. because now the Biden government is doing that. I think it's a pity to see that because we know that the circulating virus right now in China is BA.5, BA.7, which has been around the world, circulating for quite some time. Right now, the new virus is actually from the U.S. XBB. So should we stop? Should we test the U.S. travelers, US passengers? I personally don't agree. I think, I totally agree with my colleagues. Yes, we need to do a better job at identifying as early as possible the new strain, and we need to strengthen the international cooperation instead of probably politicizing again the virus.
Right, so strengthening the national, international cooperation would be much better solution. But Professor Cowling, as the travel rush for the Lunar New Year is to begin soon, it is reported that more than 2 billion people are expected to return to their hometowns in the countryside, where vaccination rates are much lower. Given the Lunar New Year, how bad should we expect the surge to be in the future, and when will it peak?
Well, if we think about city by city, I think some cities' epidemics have already peaked. Beijing, I think, has already peaked. Shanghai already peaked. Some other cities already peaked. But for rural areas, maybe some of them have avoided outbreaks of the virus so far. But as the travel starts up for the Lunar New Year celebrations, the virus is going to find its way to every corner of the country. Nationwide, I would imagine the peak in infections is occurring at the moment, or certainly within the next couple of weeks. But for rural areas where the healthcare provision is maybe not always as good, I'm quite concerned about this month and also February with more scenes as we've already been seeing of hospitals packed with patients and unfortunately a lot of COVID mortality. And the mortality rate would likely be higher in rural areas than it is in cities, unfortunately.
Right. Now, Mr. Su, I'd like to also tap on what Xi's thoughts are on economic sector. Now, Xi's leadership did a U-turn on its zero COVID policy. Now, to secure his power, he will be looking for an economic recovery. But is the economy going to be able to rebound? And if so, how long do you think it will take?
I don't think there's a dispute about whether the economy will rebound, whether it will recover in 2023. That's consensus, yes, it will recover. I think the difference is really right now, whether it will recover from the second quarter, for example, beginning with the month of March, or beginning with the next half, with June, basically. So I can give you an example. I live in Beijing. I stay in Beijing. Beijing peaked basically on December 22nd. And within a week's time, if you check the local numbers, dine-in business, restaurants for them, there's an increase of more than 200%. And if you look at the top ranking travel website, trip.com in China, and the search for international travel increased during that time for more than 300 times, more than 300%. So you can see there's a desire and there's a recovery going on. So I think also it could vary from sector to sector. For example, dine-in business would recover sooner, tourism would recover, and then some other sectors could become slower. Another example is the company which provides the components to Apple iPhone and other products in Zhejiang province in central China. So 90% of their production capacity has been restored basically within a week's time. And this virus is interesting in a sense. It came quickly and it spreads fast. And then it leaves, and I think the city recovers basically in a couple of weeks, sometimes in 1 week's time, you recover. And so in that sense, I think people are more optimistic about the economic rebound.
Right, Mr. Su, in addition to domestic front of China, what impact is this COVID-19 surge in China going to have on the international community and, to global supply chains?
I think internationally, in terms of the pandemic, I'm not sure. I'm not an expert on that because this is not the new strain of virus. I'm not sure they will have a big impact, with the arrival of the Chinese travelers. For example, it's like what has been said by the tourism minister from New Zealand said, the risk is minimal from Chinese travelers because it's the same strain. And as far as the global supply is concerned, I do see this is a good news actually, because China is in a sense the center for global manufacturing. So a lot of components, a lot of products that's connected to the Chinese economy. If there's a quick recovery of the Chinese economy, global supply chains will be better protected. I would say it will be smoother, and then it will be a contribution actually to global economic development there.
All right. Unfortunately, that is all the time we have for today's edition. But thank you, Professor Cowling, for your insights. And thank you, Mr. Su. It was a pleasure to have you with us.
Thank you.
Thank you.
Now, that's all for Within the Frame for tonight. Have a great rest of the evening. And we will be back tomorrow with more in-depth stories on the issues happening in South Korea and, of course, around the globe. Thank you for watching and goodbye.